Hey, this is Dr. Cipperoni from Active Performance Care here in Solana Beach. Today we're going to be taking you through a video of how we treat hip pain in the office. So we'll show you the assessment we do and give you kind of an idea of what treatment looks like here. So that's coming right up. I'm with Eric, the owner of Stratum Fitness here in Solana Beach as well, and he's been having some hip pain. So why don't you tell us a little bit about what's been going on there?
Yeah, so it's been off and on for a couple of years now. I would say that it started more kind of like a groin adductor type of pain, and then it's kind of migrated over time. It's gone more towards outside of the hip, low back sometimes, just depending on what's kind of aggravating it.
Okay. Okay, with hip pain, the first thing we want to do is we want to rule out the lumbar spine, make sure that the low back is not referring any of that pain to the hip. So once we've done that, and we already did that on Eric, we know that we are dealing strictly with a hip problem. So the next thing we're going to do is we're going to put him through an exam. So we're going to check hip flexion here, which his is pretty good today. We're going to check a couple other ranges, external rotation, internal rotation. We're just going to see which ones are limited, which ones might be causing some of the pain. Is he having any pain as we're doing it? Is any positions causing him any pain? So we're going to look through range of motion. Next, we're going to look at some muscle testing. Hold right there. Okay, so not too bad. So the muscles look pretty strong. Now we can test muscles on the outside of the hip. So go ahead and hold right there. Don't let me move you. Okay, good. So that's looking pretty strong too. And here, go ahead and hold right here. Don't let me push the foot down. Good. So a lot of his muscle tests are really strong, so that's good. We know that we're probably dealing with more of a joint issue. If he's not having any pain with the muscle contractions, we know that it's probably more joint related. Most of his pain is actually coming from the capsule, so if we think hip's a ball and socket joint, the capsule covers that. And he just had a slight restriction in his posterior capsule. That's where the majority of his pain was coming from. So what we're going to do is we're going to work that out through some ART. So Eric, can I have you straighten the leg here? We're going to get right deep onto that hip joint, bring the leg all the way up towards you that way. Good, up, 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 and drop down toward the floor. There we go, good, and back. And again. And usually with capsular pain in the hip, this can actually refer even to the groin or down the leg. So the capsule has the potential to refer into different areas of the hip. So it's always important to evaluate where that pain source is coming from. And one more here. Okay. Along with working the joint capsule and a few of the muscles around the joint, with Eric, what else we've been doing as part of his treatment plan is we've been adjusting the low back and the hip. So we want to be able to increase the range of motion in the hip, and that's with the adjustments. That's where they become very effective. So we'll put more movement into the joint. So what we're going to do is he'll be on his side here, leg will be straight. He's just going to roll this shoulder back. Good, nice and relaxed here. Good, and very light adjustment. And then after the low back, let me have the under back here, please, Eric. So after we do the low back, we're going to do the hip. So for that, we'll just go nice and relaxed, and we'll just do a little bit of a pull, kind of open up that joint space. Good. Okay, so after the soft tissue work here on the muscles in the joint capsule and the adjustments, we'll be going back to Stratum. Eric and I are going to go through some corrective exercises that he's been doing to help maintain the adjustments and the work we've been doing here in the office and to make the hips stronger.